I'm talking today with Carson Ragan. She is a CEO and certified nurse midwife. Almost said wife.
You got it right.
That'd be different, right?
Certified nurse midwife. You got it.
With Toomey Healthcare. Thanks so much for joining me.
Thanks for inviting me. Pleasure to be here.
Yeah, so Toomey Healthcare. I know nothing about blood makes me pass out. So I know nothing about that whole category. So what do you do in that space?
It is actually a very exciting opportunity coming to the area this year.
Yep.
Toomey Healthcare is a concierge medical practice. A lot of people don't know a lot about concierge medical care. The ones that do typically go to a office that may have extended hours, longer visits. But Toomey Healthcare actually has 3 divisions.
Okay.
OB to me, GYN to me, and peds to me.
Got it.
So what we would do, especially with OB to me, is we actually take the OB/GYN office to the patient's home or office at a time that's convenient for them. Extended hours, extended appointment times. I'm not sure if you're aware, but the average pregnant woman goes to the doctor's office 14 to 16 times in a normal pregnancy.
Oh, wow.
That's a lot of time off from work. That's a lot of childcare, babysitters to arrange, sitting in Atlanta traffic.
I was about to say, the first thing that came to mind was Atlanta traffic.
Traffic. And then once you get there, you may be in the waiting room for a very, very long time. And then maybe end up with 5 minutes with your provider, which leaves very little time for talking about concerns that you may have during your pregnancy, assessments, planning, talking about the delivery and how to prepare for that. So we bring that to the woman and her family when it's convenient to her, and give her more time to assess and plan and educate. That's
very nice. I've done a bunch of research back in the day, and consumers, depending upon the context, fall into 2 categories: convenience. So I want it to be more convenient, or I want to save money on it. And those are really the splits. So this definitely falls in that kind of convenience category. Like
Absolutely.
I want it to be, I don't have time for it. I don't have the traffic. You said, I think if I had a lot of kids, like, do I even find a babysitter, if I've got to go?
Exactly.
Yeah.
Some doctor's offices won't even allow you to bring your children with you, which makes it even more challenging. So,
wow.
Yeah. So you have to kind of balance, what is your time worth? How valuable is it?
Yeah.
And, what works best for your family? Because oftentimes the fathers of those babies like to be at the visits as well. So you're talking about 2 people taking time off from work and securing
My daughter's 21, so I did a lot of visits, but I don't remember how many we did. I do remember the one where we did the glucose test because it was a very long.
That's a long appointment.
Yeah, that was long.
Yeah. And that's just for a normal
appointment.
pregnancy.
Oh, yeah.
If you're high risk, you start going to the doctor at 32 weeks, twice a week.
Yeah, well, and high risk is
monitoring.
Younger than most people think, isn't it? It's like
more and more diabetes now, more hypertension. Yeah. Anybody over the age of 35 have increased risk. So, it's important to be able to get that care, but also at a time and a place that's convenient for you.
So talk me back. So tell me, like, what did you do in your past before you decided to venture off and do this?
Well, I started off as a mom at a very young age, and I had not heard of a nurse midwife. I didn't know what was involved with that, but after having a couple of babies way too young, I did have my first experience with a nurse midwife, and I knew right then that's exactly what I wanted to do.
Oh, okay.
It made such a difference to me. That was with my 3rd child, just the extra time and attention, and I had 2 very medically involved pregnancies and deliveries, so I didn't want to experience those things again. And she was just amazing. She spent the extra time with me. I'm still a young mom, so a lot of education. So I went to school to become an RN first.
Okay.
Worked 8 years or so after being an RN in labor and delivery. Loved it. It's my passion. I love helping families through that time of their life. But I was missing that continuity.
Yeah.
You're with them during the birth of their baby and maybe the day or 2 after, and they're gone.
Right.
I wanted to experience that pregnancy with that mom and that family through the whole pregnancy and even afterwards. So I went back to graduate school to become a nurse midwife. Love it. You get to see patients from the moment they find out they're pregnant all the way through their pregnancy, delivery, postpartum, and even their annual GYN care, which is amazing. You just build those relationships.
Right, yeah.
What I found was, while I love what I do, I don't like the way that I'm doing it.
Yeah.
In the sense of, in a typical busy OB practice, you may have 25 or more patients per day.
Mm-hmm.
And you're only blocked maybe 10 or 15 minutes to spend with those patients. So that doesn't leave you a lot of time to get to know these patients, to really get a good assessment and education and plan with them. And, they're pressed for time. You've got a full waiting room of
Right.
people.
Mhm.
They want to get in, they want to get out, but you want to give them all this wonderful care. And so from a patient's perspective, I've been a mom
Yeah.
and had to wait and not get all my questions answered the way that I thought. And you get home, you're like, wait a minute,
I meant to
I got to ask this.
Yeah,
and,
yeah.
and oh, shoot, I'll have to do that next time. But then also from the provider side, you want to give that care. You want to spend that time with your patient. But the way that, busy practices are, that's the way it is.
Mhm.
And on top of not having a lot of time in the office, you may or may not be the one on call when they deliver.
Right.
You have a practice of 8 providers. It's very rare that you're going to be the one there with them during that time. So
Yeah, when we had our daughter, the one doctor we did not want was the doctor that showed up for the delivery.
or the one you've never met before.
Right,
I mean,
yeah.
that's usually what happens.
Yeah.
But with our model of care, it provides us, it alleviates all of those frustrations.
Right.
You get to spend the extra time. It gets to be a time that works for you. And we only take so many patients at a time so that we can guarantee that extra time and that we're not stacking on to where you don't get that special individualized care.
Okay, and so this was something that you just were, it sounds like it's kind of interesting because a business I sold recently was because of that. We were only in with the customer for a very brief period of time. We would tell them what the problem was, and then we were done. And we had no idea if they took our advice. We had no idea what happened. And so you lose something in that, right?
Right.
In that continuity.
Right.
So for people that might not know, explain what a nurse midwife is.
That is a great question.
I think that there may be some Netflix shows
Yes,
that
there
have given
are
us a
few.
different opinion
There
of what
are
that
few.
might be. So yeah.
So a nurse midwife, the first thing that a lot of people think of is that we're going to deliver your baby in the woods, squatting behind a
Or a
tree
bathtub.
with no medication. That is not what we do. There's actually 3 different kinds of midwives.
Okay.
There's a lay midwife, which is kind of what you see depicted in some of the movies or books where they just kind of deliver babies in an off-site location at home or, in a tub or in the woods or what have you, but they don't have any medical training. They kind of learn from someone else who learned from someone else. Then there's a certified midwife, who's someone who has been to a midwifery education program, and they're pretty common in other parts of the country. They deliver in home, some in homes, some in birth centers. But in Georgia, they're very, very strict about the type of midwives that can practice in Georgia. So we are all certified nurse midwives. So the difference is you're an RN first, and then you go back to graduate school for several years and attend several deliveries. And there's a process. And by the time you come out, you are an expert in pregnancy and childbirth. But you have that medical component, that RN background that services the other areas of the body that might go wrong during pregnancy.
Okay.
So that's the big difference. So in Georgia, to practice legally, you have to be a certified nurse midwife and in collaboration with a physician, so that if there is an emergency, let's say you need an emergency unexpected C-section, there's a doctor readily available to do that for you.
Okay.
Or other invasive medical procedures, there's already that relationship established, so there's not a delay in care or having to change providers.
Okay. Interesting. And so as you decided, that maybe you wanted to approach it differently, there's a big difference between saying that, because I know a lot of nurses in my life and they're like, oh, I wish the way that I practice was different. And, they'll complain about it, but they don't often go off and decide to build a company around it. So where did that come from?
Well, I come from a line of some entrepreneurs and forward thinking. And so, as I said, as a patient who's experienced some of the problems I shared earlier, and as a provider, having experienced some of those same frustrations on the opposite end, I thought, why not make this better for both parties? We are basically taking the OBGYN office to them, but also providing the security and safety of delivering in the hospital.
Yeah.
I'm not against home birth. It's just not something that I practice.
Right.
So I prefer to bring all of that state-of-the-art equipment and care and education to the patient, but also still provide them with all of the state-of-the-art equipment at the hospital in the event of an emergency, working with the collaborating providers that can assist if we need them.
Yeah. And so, but again, I know you come from a long line of entrepreneurs and small business owners. You've decided to take state-of-the-art equipment and put it in a car and go to wherever somebody's office are. I mean, that whole thought process, did you sit down and you wrote it on a napkin and told somebody about, like, how did that?
Well, about 6 years ago is when this really started coming to light. And it's like, there's a problem. And if I'm a problem solver, If I see there's a problem with something, I want to change it. I want to make it better.
Okay.
How can we do that?
Right.
How can we make it work for that patient that's going to make their experience even that much better? How we can make it better for the providers. So why not change?
Yeah.
I mean, just in the last 10 years, all of the things that can be delivered to you at an instant. I mean, you're talking about Amazon Prime, you're talking about all kinds of food delivery, all of these things that are brought to you when you want them. Why can you not have quality healthcare the same way?
Right. And it would, in my opinion, and I might be wrong, but it might make people more compliant. Am I right?
Well, if the access is there, if there's not that barrier of all of those things that we listed that can impact somebody's ability or desire to seek out that care, you take that barrier away, then, you're investing in your health instead of just doing what someone told you. It's making it more available to you. So why wouldn't you invest in yourself that way?
Yeah. And so in that space, where did you start? Did you go buy, was it like the Ghostbusters? You went and found a big car you could drive around?
No, because,
Because wasn't that an old ambulance? I think they bought an old ambulance.
As cool as that would be, with a nice big old RV with, pregnant people just laid over all the side, that would be awesome.
Yeah.
However, the clientele that we deal with, we also want to respect their privacy.
Yeah.
I don't know if you want the neighbors to know that someone's swinging by to check on your pregnancy. They may or may not know you're pregnant.
Right.
So we try to, our providers will show up in an unmarked vehicle and not go in looking like, oh my goodness, the Ghostbusters is here to examine the pregnant woman, because everybody gets real nosy when it comes to pregnant women.
Yeah,
so,
right.
We're interviewing physicians that want to collaborate with our practice. We will go to the patient at their home or office. If there's a medical procedure that needs to be done in an office setting, they will go to our collaborating practices office.
Okay. All right.
We don't, bring literally a whole office building with us.
You're just doing the well mom checkup kind of stuff as you go through.
All the prenatal visits can be done at home. The postpartum visits can be done at home. Certain type of contraceptive management, insertable devices can be done at home or office. Atlanta is such a big city, but the OB community is very small.
Yeah.
So a lot of providers know each other, even if they're at other facilities. So we want to make it a collaborative effort. We may have a patient that's planning to deliver at Northside, or we may have a patient planning to deliver at another facility, a WellStar facility. We want to work together with all the providers in the community to make it easier for that patient and that provider, and be able to share whatever medical records need to happen to make it a seamless transition for the patients.
Okay. Well, we're going to take a commercial break, and when we get back, we're going to talk a little bit about some of the things you've learned along the way of bringing this to life. Okay. So we're talking today with Carson Ragan. She's CEO and certified nurse midwife of Toomey Healthcare. You're listening to Build Your Best Business. I'm your host, Eric Holtzclaw. We'll be back in just a minute.
Eric, tell us about Laddering Works.
So Laddering Works is a company that helps other businesses in one of two ways.
Okay.
So your company is either growing and you're not exactly sure how to keep up. So you need to scale operations, maybe raise some money, those kind of things.
So growing too fast.
Growing too fast. Okay. Growing too fast. You got kind of structural, you walk in every day, there's a fire. You've been doing it longer than 3 years or 1,000 days, and you still feel like you can't step away from the business and take a vacation. So we help companies on that side. So sort of operational support, looking at their financing, seeing if there's a way that we can help them, get to the next level. Or you're a company that's not doing any marketing at all. So you are maybe stalled. Your business has gotten to a certain level. You make a certain amount of money every year, but you've never gotten above that. And we come in and build marketing structure. So both of them are operational at the end of the day. It's about creating a process and a way to approach it that's strategic. It's that owners don't often know how to do both of those. So they're really good at sales, which means they may need operational structure because they're out signing more customers than they know what to do with. Or they've built a beautiful product that's the best kept secret. And so they need somebody to come in and help them market that product. And so that's the kind of businesses we look for. We come in as a stopgap, and we work with a company for somewhere around 12 to 18 months typically, solve those problems for them and leave them better than we found them. And we're back. You're listening to Build Your Best Business. I'm speaking today with Carson Ragan. She's CEO and certified nurse midwife, Toomey Healthcare. And we were talking about the idea in the first session and, how that kind of went well with your desire to see things more fully, like from the beginning of when somebody finds out that they're pregnant till afterwards, which I love that idea, and that's one of the things that you run into. We like this instant, but sometimes instant means that you also don't always get consistent, like it's like, oh, that means if this place is open, then I just am going to walk in and see whoever, right? And This is something that you want to have a relationship with somebody. They understand everything. Very an important part of that. So the idea to do it, like you were working somewhere and you quit, like I keep trying to get to that. Like, were you drawing on a napkin and then somebody told you were crazy and you're like, but I'm doing it anyway. Like what happened?
It was actually a combination of things, to be honest.
Okay.
I mean, like I said, as a busy mom of 4 kids.
Oh, wow. So you have 4 kids and you're starting a company.
Got remarried.
Oh,
have
wow.
a bonus daughter.
Oh, wow.
I was working in a very busy OBGYN practice, seeing a ton of patients a day, having crazy call schedules and not a lot of time with the family. As a provider, commuting to the office, taking an hour and a half, 2 hours one way of my day away from my family. All of that started brewing together, and then seeing the patients getting frustrated. And then, there's actually a show on TV that kind of sparked something in me, Hank Med. Have you ever seen Hank Med?
No, I haven't.
It's this concierge medical practice based in the Hamptons for the uber rich elite people.
Okay.
Where he goes.
What's it called again?
Hank Med.
Okay. Is it
Great
something
series,
like
great
Netflix
series.
or Prime or something?
Hulu, something like that.
Oh, okay.
But I remember one day watching it with my husband, and I was like, this is great. I mean, he's completely catering to billionaires and all this kind of stuff. And I was like, this is great that he just has this doctor that just shows up with his portable x-ray machine and the whole 9 yards for billionaires. But what about...
And most billionaires are hypochondriacs, so he probably has a lot of practice,
but
right?
there was always an extra special event that was happening. This is a TV series,
Right,
so
exactly.
it was not just paper cut. But when I started thinking about it, I was like, why isn't there more concierge medicine, not to the elite, but to more of the middle class? Why is this not accessible to us? And then I thought, pregnant women.
Oh yeah.
And I started doing more research about concierge medicine. And concierge medicine is actually growing quite a bit nationwide. The focus, though, is it's mostly primary care. You may have an internal medicine or primary care doctor, and they have, it's like retainer based. You pay a certain fee per year, you get so many visits, you get email or phone direct access to your provider, extended visits. That's great and wonderful. But most healthy people, they go to the doctor, for their annual, maybe a sick visit every now and then. But what about the people that are going, 14 or 16 times during the year? Those are the people that could really benefit from having that service. So, the wheels started turning, and it's like, well, providers would love this too, because then you can really customize your care to the patient, and you're not having to squeeze in 25, 35 patients a day. And still get that connection that I think a lot of us went into this field for. We love connecting with these women and their families and helping them have healthy births, healthy moms, healthy babies. And it just evolved. And it took a little longer, to work out the kinks. It's one thing to start a business by itself.
Right.
But to start something that's not really been done before.
Oh yeah. Disruptive is a lot harder.
Holy smokes. It was a little bit more challenging than I thought.
Yeah, well, disruptive, but the things that you did that are really smart is you picked a niche. You picked a niche with a consistent need. Because, sometimes you'll pick a niche and it's like, well, they need it, but one time, right? Or so those two things are a good formula for success. Because you're going after pregnant women, right? And they have a consistent number.
Good job security. We just keep having babies.
Yeah, exactly.
Just keep having babies.
Yeah, exactly.
So,
Yeah, and so talk to me about, did you have to go through some kind of like special certifications? Is this just a thing you could stand up as a business like you would a regular services business? How is insurance involved in this at all? Like some of those things go through my mind of taking the model and breaking it, and what you had to explain to people to get them to get it?
All of the above. You have your own special, very strict licensure, just being a provider.
Yeah.
Nationally, and then in the state of Georgia, and then of course you have to have your business license to have. But what's unique is because we don't have a medical facility. Toomey Healthcare does not have its own facility because it's mobile.
Got it.
So our collaborating providers, if there is something to be done in an office, that's within their facility. So we didn't have to go through the special licensure of having building to code for a medical office building, which is awesome.
Yeah. I can imagine.
But their insurance is a big deal, especially in the OB community. Malpractice is a huge expense and concern for a lot of people. As we have interviewed physicians to collaborate with, that's the first thing that they're like, okay, what about the malpractice?
Right.
How does this hold me liable? You know, if you're seeing patients out in the field per se,
out in the wild,
how does that affect me?
Right.
And you know, after speaking to attorneys and malpractice provider or malpractice insurance companies, it doesn't change the liability for them as if we were working as a certified nurse midwife in their office.
Got it. Yeah.
It's just a satellite location, if you will.
Yeah.
So we still follow all of the same guidelines from American, the ACOG and ACNM to guidelines. All of that's the same.
You could say anything. I wouldn't know. So it's good.
All of those. The point is that the medical care doesn't differ based on the location.
Right.
But breaking that mold and talking with hospital administrators and talking to physicians, this has not been done before. So
I can totally hear that. We've never done it this way before, right?
And it's a very conservative area,
Yeah,
you know, and a lot of people don't want to do something they've never done when it comes to a risky area of medicine.
Yeah.
So,
yeah, and you know, and it's interesting how your background for building this kind of business seems incredibly important to it, because I go into businesses often where I know nothing about, like, oh, you do this, and they kind of teach me and it's okay. But knowing the area would be a very important part, because you're being so disruptive.
Right.
Because you've got to be able to have all those, this is why it's okay, this is what it looks like. And you're not only sort of making the industry feel good about it, but you've also got to make the patients feel good about it.
Exactly.
Yeah.
Exactly. We marketing to the patient is key, because again, one, a lot of people don't know what a nurse midwife is, and they think I'm going to come in there and deliver their baby in the kitchen floor with no medication. Yeah, they're not going to call me. Right. But if they understand that it's bringing the office to them where it's convenient, but we're also going to deliver that baby in the hospital, and you can still have an epidural if you want to have an epidural. You can still do all of those things, and that doesn't change the thing. So you have to, it's marketing to the physician and marketing to the patient are two totally different avenues, because they're thinking separately. They're thinking differently about the concerns.
Types of education. Yeah. So as you've talked about sort of this seem like kind of industry specific type of things that you've run into to get this off the ground and those types of things, are there any like other things you would share to someone if they came to you and say, hey, I'm about to do this, or go back and tell yourself, hey, don't do that?
Well, like I said, this idea came 6 years ago.
Yeah. Well, it takes some time to percolate.
Yeah. You know, and teasing out all the back end, okay, how are we going to make this work, and building the business model and the financial structure, because while we're launching in Atlanta, it actually has a national component. We hope to expand within the first 5 years, which is a whole nother set of planning. But one thing that I would say, this idea came 6 years ago. We thought, you know what, the youngest, she's now 16, junior in high school, we'll launch this when she graduates, you know.
Right.
Last one out of the nest. We'll do that. Not a good idea. Don't wait. Don't wait. If you believe in something and you have a plan or a mission to do that, I wish I would have started the process sooner.
So yeah, unpack that for me a little bit.
Okay. So this year we had some family changes, some dynamics that said, all right, I'm going to go ahead and cut back on my hours at my full-time job and work out some family issues. But then, you know, if I have time, I'm going to really start pushing to get this launched this year, because we've had everything ready. It was just kind of waiting for that last hit the button.
Yeah.
Well, once you hit that button, there's actually a whole nother list of things that need to be done once you hit that button.
Yeah.
So I would recommend that, if you have your plan and you have your model and you have whatever it is business you're trying to start, don't wait.
Yeah.
Because even when you think you're going to launch, you don't necessarily launch
Oh, yeah.
on that date. There's a lot of behind the scenes things. I had no idea what was involved with building a website. I just thought, somebody's just going to do that real quick. No, that's not how it works.
Right.
Although I do have some very talented marketing people that have been helping me. It takes longer.
Yeah.
I mean, it took me forever just to finalize a logo.
Right.
I mean, that's the easy stuff.
Yeah.
But when you start getting into contract negotiations, and especially when you're dealing in healthcare, it's taken longer than I expected.
Yeah, and it's really that is such good feedback, and it's something that people say all the time is, it's going to take longer and it's going to cost more and blah, blah, blah. And you say it to yourself, and then it still does, and you're still surprised, right? You're like, but I thought that I had a margin of error in there and it was still going to be that. And starting it, there really is no good time other than today.
Don't wait.
Get it done.
If you don't do it, someone else will.
Oh, and that's the thing that'll make you kick yourself. Like when you look back and say, and I was going to do that like a year ago, and then somebody else is already out in the market, and then you're like, and not that there's not room, but for some things there is that first mover advantage where they've established it and they get the name behind it, or meaning like we say you want to take a Xerox of something, like it's a copy, but we still may call, hey, I need a Xerox of that, right? So future plans. So you kind of briefly talked a little bit about that. You said, other states, but
Yes.
what's some other things that you're thinking about?
Once we launch here in Atlanta and it's up and going and thriving well, we hope to or plan to launch next year a pediatric version of the same thing.
Okay.
So right now we're focusing on OBGYN patients, but the beauty of that is as you create those relationships with those families, now they have new babies and they have other children that may benefit from the same service. So bringing that pediatric care to them at their home, doubt they'll be at their office, but at their home, or if the parents are away at work and the nanny's there, whichever, just bringing that to them. So that's one thing that we're really excited about in the next year or so to launch. But as the Atlanta market grows, we want to take this to other incomes, any other high income cities that have parents and families that would benefit from this.
Yeah.
I mean, we start in Atlanta, one, because we're here, but two, if you look at how much Atlanta is growing and the corporate world of Atlanta. I mean, we have so many major companies based in Atlanta that employ executive women, and they don't have time to be taken off for visits.
And it's time, and it is really traffic. I mean, the traffic
is.
Here is a nightmare.
It could be a 5-mile commute that could take you 50 minutes.
Well, we had somebody here a couple of months ago, and she said, I noticed that people in Atlanta don't talk about things in distance. They talk about them in time.
Right.
Because it could be 3 miles from here, and it's going to take me an hour.
Exactly.
So, she's like, you talk in time. Like, because we know how much time. So, and the pediatric thing, you were talking earlier about going to visit the office. Like, I remember with our daughter, my wife, one of the biggest things is she would walk in and there was always, she would be walk in and our daughter was sick, but there was the sick room and the healthy room.
Right.
And she's like, well, I don't want to go in the sick room even though I've got the sick kid,
Exactly.
like I don't want to be extra sick. Right.
Yeah. So imagine, newborns and even other kids, sports physicals and all that, trying to schedule all those things when you've got a busy household or a busy work environment. It's just, if it can come to you, why not?
Absolutely. Well, I love it. It's a great model. I love the on-demand model. A problem with it is it's destroying some of our retail because we don't go into the store, but it's so awesome to have stuff just show up, right?
Exactly.
Like we do the apron every week and it just shows up on Sunday and I'm like, all I got to go to the grocery store for is milk. That's about it.
That's perfect.
So wish you the best of luck. You have to come back on and kind of give us an update and let us know how it's going.
I will.
Yeah.
Thank you.
You've been listening to Build Your Best Business. I've been talking with Carson Ragan. She's CEO and certified nurse midwife. God, I have a problem with that. Not your name, but
midwife,
that part.
you got it.
Midwife with Toomey Healthcare. You've been listening to Build Your Best Business. What are you going to do until next time to build your best business?